convoluted tubule, distal convoluted tubule, and the nephrotic loop, which is called the loop of Henle. Okay, so here it is. The one closer to the Bowman capsule. You remember when we do closer would be proximal, farther will be distal. So here is the proximal convoluted tubule. Proximal convoluted tubule, and then it will go all the way down to the loop of Henle, or the loop of the nephron. Loop of Henle. Note the how it is like this. Okay, and then going away from the loop of Henle will be the distal convoluted tubule. Distal convoluted tubule. So again, nephron, okay, it's a functional unit. Okay, receives blood, and then take out whatever is necessary, and then the waste will be excreted as urine. Okay, so first there is filtration, then there's reabsorption, and secretion. That's what the urine is. It also affects blood pressure, red blood cell production, and calcium absorption. So here, around here, there is something called the juxtaglomerular apparatus, which we'll learn later. That is what will affect the blood pressure. It senses the blood pressure. Okay. So let's start from the beginning again at the glomerulus. Okay. The glomerulus capsule, it is surrounded by these things called a podocyte. Podocyte, okay. They're like finger-like projection. It's got holes for filtration. Okay. So this structure is specialized for filtration. To filter so much blood, you need a few adapter, you need high pressure. So the pressure's pushing the blood through. Okay, as pressure pushes through, things will start coming out. Right? Podocyte and pedicel and filtration slit. Okay. Basement membrane and this fenestration, this will all allow things to pass through. Okay. So here's a recap of the filtration part. So this is at the glomerulus. Okay, glomerulus. Okay, so moving to the stuff. So negative item are repel and positive stuff will move through. The mesanglial cells will help contract and affect the flow. Okay. Filtrate does not contain cells or large protein and is slightly positive in charge. Okay, so that's just the filter part. Now outside of the glomerulus, so here's the glomerulus, here's all the podocyte. Just outside of it, there's something called the juxtaglomerulus apparatus. Juxta meaning next to, okay. Glomerulus is that thing, okay, and an apparatus, okay. So the juxtaglomerulus apparatus, that is what monitors the blood pressure, because it's just right outside, and it will monitor the pressure of the blood going into the glomerulus, okay. Outside of it, so here it is, okay, there's something called a macula densa. Macula densa. Here's that juxtaglomerular cells, okay. Here's the afferent, and this one is the efferent, okay. And next to it, after the glomerulus, is the proximal convoluted tubule. The macula densa and juxtaglomerular cell monitor composition of the sodium and the flow of your blood, okay. Macula densa is a special cell, releases paracrine substance when the osmolarity of the filtrate is not balanced. This affects the juxtaglomerular cells, which affects the arteriole, therefore glomerular filtration rate constant. Okay, so this, okay, whenever it senses the osmolarity that is not balanced, okay, it will then affect the juxtaglomerular cells, which then will affect the arteriole, which will affect these arteries, Okay, therefore, then it will affect the glomerular filtration rate. What else does the macula densa do? This is where the blood pressure. Okay, so when the flow and blood pressure decrease, okay, so there's a decrease of blood pressure. Now your glomerulus will feel it. Okay, the macula densa will sense a low fluid flow, so it's not enough, or a low sodium concentration. Okay, then the juxtaglomerular cell will secrete something called a renin. Okay, renin. So after renin is secreted, it is then converted in the liver to angiotensin 1. Okay, angiotensin 1. So renin will cause the liver to release something called the angiotensinogen. Tensinogen will then convert to angiotensin 1. Okay, then it's actually going to go into the lungs. Okay, and will be converted into angiotensin 2. Okay, then several things will happen. Okay, first it will have a asympathetic will cause a vasoconstriction, so it will cause all your artery to be tighter. Okay, so then the blood will increase a little bit. Then it will cause your ADH, if you remember ADH in the pituitary. Okay, it will cause water to come back in, so it will not. It will cause water retention. It will cause you not to pee so much. Then it will also cause sodium and chloride to absorb in the proximal convoluted tubule and the loop of Henle, so that sodium, with sodium will go with water. Okay, so it will be absorbed. Sodium will be absorbed, and then water will come with sodium. And then lastly, it will cause the adrenal to release aldosterone. Okay, which is a hormone in the adrenal, which is right on top of the kidneys. Okay, to release aldosterone to control your blood pressure. So that's how the blood pressure is restored. So we already saw filtration. Now we're going to look at reabsorption and secretion. Okay, so the proximal convoluted tubule, which is right next to the glomerulus, okay, we're going to look at the loop of Henle and the distal convoluted tubule. The proximal convoluted tubule are simple cuboid with microvilli, and this is where most of the reabsorption will occur. At the loop, continuum of tube with simple cuboid and squamous, and distal convoluted tubule, simple cuboid, it does secrete and some reabsorption. Okay, but we're going to look at it a little bit more closely. Collecting duct are not part of the nephron, but still affect the urine. So here's the collecting duct at the end. It has receptor for ADH. When ADH is present, we saw what happened to ADH. The cell makes water transport and more water return to the body. Okay, so when ADH is present, more will be returned to the body and not down to the pyramids. Okay. When absent, no more water return in the collecting duct. So that's part one of the kidneys. So now we're going to actually look at how urine is formed. Okay, so urine is glomerular filtration minus the reabsorption. So whatever is filtrated, and then everything is reabsorbed, and then whatever is secreted. Okay, so we're going to look at something called the glomerular filtration rate. Volume of filtrate formed by both kidneys per minute. So at rest is about 5 liters of the cardiac output. Okay, So 1 liter will enter the kidney for filtration. It's about 105 to 125 milliliter is filtered per minute. 99% will be returned to the blood, and the 1% will form the urine. This is roughly, okay. Of course, not everybody's the same. So filtration, there's something called the hydrostatic pressure. So hydrostatic pressure, I don't know if you remember, it's like a water hose. Let's say a water hose that has holes in it, okay? So you turn on the water and it's going to push through, and then some of the things will be pushed out through the sides of the holes. Okay, so the force of that water going through is called hydrostatic pressure. The main force that moves substance by filtration through the glomerulus capillary wall is hydrostatic pressure of the blood inside, okay? So blood hydrostatic pressure, osmotic pressure, and blood hydrostatic pressure. So roughly this is the net, 10 millimeter, okay? What opposes is the pressure or pull of the fluid back into the blood. So this is the fluid back into the blood. The amount of fluid in the capsule and the amount of stuff in the blood. Okay, so blood hydrostatic pressure is the one pushing through. Okay, osmotic pressure is opposite of it. It's going out as well. And then the capsule hydrostatic pressure, the pressure inside the capsule. So net filtration pressure. Net filtration pressure. Force favoring filtration. Okay, glomerular capillary hydrostatic. So the force favoring filtration, which is that hydrostatic pressure, whatever is pushing through, minus the force of the opposite filtration. Okay, so then that would be whatever is filtered out. So minor blood pressure change or osmolarity of the fluid, there will be a major change in the filtrate form. So again, hydrostatic pressure is the pushing through of the blood. If there is just less pressure pushing through, okay, the amount of filtrate, just a lot of changes will happen. So glomerular filtration rate is always positive. So something is always being filtered, okay? And it's done by hydrostatic pressure and the osmotic pressure, which is, you know, the water getting out of there. So let's do a recap, okay? So here is the Bowman capsule. So the blood is going to come in from the afferent tube, afferent arteriole, okay? And then it's going to exit to the efferent, okay? So the afferent tube is always a little bit bigger than the efferent. So imagine a hose that you know, a lot of water going in, and then when it's exit, you put your thumb on there or a finger on there, and it creates more pressure. So with that, it creates a pretty strong hydrostatic pressure, and it is going to cause everything to, well, not everything, but a lot of water, a lot of protein, a lot of sugar, glucose to come